Welcome to the Midlife Mavericks podcast, where we empower men in their prime to redefine what it means to thrive beyond 40. Join us as we navigate the complexities of midlife, offering insights, strategies, and inspiration to reclaim your health, vitality, and purpose. From personal stories of transformation to expert interviews and actionable tips, each episode is designed to support you on your journey to live the best life in your midlife and beyond. Get ready to unleash your inner maverick and embrace the adventure of aging with grace, strength, and purpose. My guest today is Dr. Marcus Hewitson, an experienced GP, educator, and pioneer in the emerging field of personalised functional medicine. He combines comprehensive patient assessments with cutting-edge functional laboratory testing to uncover and address the root cause of health problems. He lectures nationally and internationally to medical audiences interested in helping some of their most complex cases. In this conversation, Marcus and I talk about personalised medicine, personalised nutrition, gut health, maintaining muscle as we age, mindset, and finding meaning and purpose. There's a lot of great takeaways from this episode, so I hope you enjoy. Dr. Marcus, welcome to Midlife Mavericks.
Thank you, Andrew. It's great to see you. It's great to be on the show. Thanks for having me.
Mate, I'm super excited to reconnect really and have a chat all about nutrition, health, mindset, about your practice, and about all the incredible work that you do. I was scratching my head the other day thinking, when did we first meet? I think it was back in 2019. I'd just come back from living in London, so returning back to Australia. And I was going through my own health challenges. And it was awesome to connect with you at the time in Byron Bay. And you helped me a lot. So I greatly appreciate that and truly gratified for all the time we did spend together. But just as a bit of an introduction, I've got a two-part question to throw at you. Just pretend that we didn't know each other and we were to sit next to each other on an aeroplane. Number one is, where would that aeroplane be going? Do you have a favourite holiday destination? And then part two of that question is, if we were to start a conversation and I was to ask you what you did for a living, how would you answer that?
Okay, so that's a great question, because you and I both love to travel. So I think I reckon we'd be going to Central America, and we'd probably get off in Mexico and be traveling down through maybe into Costa Rica to do some beach time and to do some exploration and a bit of history and maybe speak a bit of Spanish. So I think that would be the start of the trip.
Awesome.
And then, I would say it's always a tough one, isn't it? What do you do? But I'd say at this point in my career, I'd say I help people change and get the results they want. Previously I would have said I was still a doctor, but the word doctor comes from teacher, docere, to teach. And I think as time goes on, as you've been working as a doctor, working on people's health challenges, you kind of, almost get into that role of finding out there are all these barriers to change and people getting better results with their health. So you kind of have to learn the skills. Otherwise, there's only so much you can do as a doctor. So I think of it as three layers, really, of what I do. The first layer is the medical layer. So I went to med school, did medicine, I worked in emergency for a lot of years, and I learned the sort of, you get your chops, so to speak, by getting around and doing those things. And then I kind of got into general practice by ruling out every other thing because I didn't want to do anything else. And it sort of was a case of eliminating this, that, and the other. And then I actually got sick in 2011 and I learned about functional medicine, which is this, or in Australia we call it more nutritional and environmental medicine, which is getting to the underlying drivers of disease, whether it's lifestyle, environment, gut health, all of those factors that you know about from your training. And then, the third layer of that onion, I think of it as the change, and that's the coaching, the mindset, and the mentorship. So that's kind of what I do. But what I love the most is helping people to get really clear on what their life's about and facilitating their health so that they can get to do what they need to do in their life. So that's it in a nutshell.
Yeah, awesome, mate. And it's a great story. It's interesting. I'm going to love digging into that because, like you say, there's been this journey of change that you've been on from, being an emergency doctor to being general practitioner to now, working in this sort of functional health, integrative medicine, environmental medicine, all that sort of stuff that you're talking about. Just to rewind a little bit, you touched on a little bit, you went through your own health challenge, or I know that you've gone through a little bit your own health challenge. I think that's really what changes a lot of us maybe from that conventional medicine practice into looking for alternative medicines. Would you like to share, or can you share a little bit of your own story there of that conversion, maybe?
Yeah, so I was already going down the road. I'd done general practice, and I'd done a lot of mindset stuff, and I'd done some personal development, and I was really interested in the mind and the health side of it. But it wasn't until the shit hit the fan, so to speak, in 2011 when my health just crumbled. So I went in for what was supposed to be quite a minor procedure, and it was actually on 11/11/11, and I came out of theatre. I asked the surgeon later, and he said, "Yeah, you came out of theatre at 11/11 on that date." So it was all pretty auspicious numbers, and my kidney shut down, and I went into acute renal failure. So nobody really knew what was going on, but I ended up in ICU, and I was actually the one to say, "I think I'm going to need dialysis," because nobody was sure when it was going to improve, and it didn't improve. So I think I was on I don't even remember much of what happened next because you're pretty foggy when you're that sick. Mm-hmm. But I was in hospital for I think 6 or 8 weeks or something, and it was a joyful moment when my kidneys started to work again, but it took them a while to recover. And then, as I sometimes say, things went from bad to worse. I started getting off balance and, walking into things, and I ended up getting a scan, and there was this massive cyst in my jaw eating into my sinus, and they thought it looked pretty ugly, pretty nasty. They weren't sure what it was. So they had to go in and operate on that. And then after that, things just got worse and worse. And I think what actually happened was there was a lot of infection there, and it kind of spread around. And when that got into the system, I mean, I went to a lot of doctors, neurologists, ENT surgeons, you name it. I went to probably 15 different doctors, and nobody really knew what was going on, mate. So, you're sort of left a bit by yourself at times, and I didn't really know too much about sort of what I know now, but I remember there was a couple of real clangers on the way where I came across people that said something that really resonated, and I just went, yes, that's got to be it. And as you do when you're sick, they say, there's a saying that the well person has 1,000 wishes, but the sick person has one, It's to get your health back. And I think I always realised, I nearly, just jumping back a few years, when I went travelling, I took a year off after my second year of medicine. I did 2 years, and then I thought I need to do something else. So I went travelling, and I was that close to leaving and doing something creative or writing or some other thing. But I had to decide what I was going to do when I came back to Australia. So I had to make the decision this day whether I was going to go back and do some medicine. And I fell asleep on a bus. We were going from a town called Baños to Quito in Ecuador. And when I woke up, there was this sign in the middle of the Altiplano, just in the middle of nowhere with volcanoes behind it. And it said in Spanish, "Health, nothing is more important." So it was like one of those cosmic slaps on the face that said, okay, sometimes the decision is sort of out of your hands a little bit.
Yeah.
And I just kept following the path. And it's been a funny path because, each step of the way, there's usually been something that leads me in a certain direction. And when I was probably at my most down and out point, my partner's sort of into plants and herbs, and she's always loved that naturopathy stuff. And she kept saying for a year when I was at my worst, she said, "Go see a naturopath." And I was like, "What are you talking about? I've got the best doctors in the world looking after me." And I wasn't getting anywhere. So, but I had this dream one night, and it was just a weather vane. And the dream went for 10 seconds. It just turned around and went the other direction. And I thought, I've got to try something different, So I did, and that was really the road out. It was a long road out, but it was I needed to go into a different direction
and travel that journey, mate. Yeah, that's incredible. How long did that last? Like, how long were you suffering from that sort of illness before you started to feel partly normal, I suppose?
Yeah, and again, really good question. I reckon, I think it was 7 years of real struggle. But I just knew in my heart of hearts that I was going to get out of it. But yeah, I had, when you're sick, you actually have to practice what you preach, because it's easy for me to say to people to quit sugar or to do this or to do that. But for me, I had every hidden stressor under the sun, gut dysbiosis, infection, mold sensitivity. I had it all. And I had to move house. I had to move offices. I had to sell an old car, which was water damaged. I had to do all of that stuff. And until I found out all of those little triggers that were triggering me to keep me sick, it really, I was kind of, you get stuck in that sickness cycle. So I think I was probably working part-time for, I actually had to take a year off completely because I was super sick then. But then I got back to sort of 2 days, 3 days, 4 days. I think it took about 7 years to get back to 5 days work. And that was a long road.
Yeah, 100%, mate. It must have been such a scary time to be like suffering with those health problems. But I think when looking at it in the perspective now, you must have such great empathy for a lot of the clients that you work with who are going through like the same sort of situations.
Well, I think that's, there was a couple of times along the way where I came across practitioners who, they just went way above, just that, whether it was just sitting with you and you're suffering or, I had one dentist who, I needed 3 more surgeries on this jaw, and none of the other surgeons wanted to do it. So I won't name any names, but I sort of paid him to do it in his backyard office, and he went in and did surgery, and he talked me through it. And, I reckon he was one of the guys that saved my life.
Wow.
And there was others. There was plenty of others on the way, but you see the good ones and you see the bad ones. And I think it's like that in any industry, whether you're dealing with, your accountant or your finance team or your personal trainers or your health coach, whatever it is, you've got to get those right people on your team. And I think, when you find those people, they're really the people that inspire you to go on and do what you do and how you practice.
Yeah, 100%, mate. Yeah, I like that message. I think it's great. And I think it's also just having that curiosity to continue to explore and never giving up. Like, just hope is such a key part of that, and just keep going, and, hopefully things will get better. I like what you said before, like you talked about the wish. The wish of a healthy man is 100 million things, maybe, and the wish of a sick man is just to be healthy again. I can remember, I think it was our first consult, the first time we met. I think one of the questions you asked me was like, what's on your wish list in terms of your health or regarding your health? And I bet there's been 100 patients sitting on the other side wondering, well, what's on your wish list, Marcus? So I'm going to put that question back at you.
Yeah, it's interesting because, I guess I don't I do ask myself that all the time. And the way I ask it now is what I will want more of and what I will want less of. Because I think it's called clarity, and that process of what do you want? When you ask it, some people, they haven't thought about what they actually want. So it's that old story of if you don't know what you want, how you're going to get there. I think there's a scene, I think it might be in Blazing Saddles, where someone's riding along on a horse and there's a guy on the ground. He looks up to the guy and he says, "Where are you going?" And the guy says, "I don't know, ask the horse." It's like, if you don't actually know. So where am I going? Well, what's on my wish? I've been writing every day. That's my commitment a couple of years ago, is to just write, because I've always loved to write and create. So that's kind of a daily habit for me now. And I think building habits is a huge part of it, because in the past I might have said, I've got to wait for that inspiration to do something that I love. But I think as you mature and as you understand yourself better, you go, well, there's actually no real inspiration. You get the inspiration from turning up, opening the laptop and typing the words. So I just set the clock for 25 to 30 minutes and I just go for it. And over a couple of years, like I've got a lot of ideas that have come from that. So yeah, my wish list is to keep writing. I love to create. I love to clarify my thinking through that process. And I think the other thing that I'm loving to get back into is the creative side of life. And we're going to actually have a trip in a few months' time, and just bought myself a nice new camera, so I want to get back into my photography. So there are a couple of things that are on the wish list right at the minute.
Yeah, incredible, mate. That's awesome. It's good to have like a purpose, or good to have a focus. Like you say, just being able to sit down and start to write, or get back into photography and stuff like that must be a good feeling and give you I suppose that sort of accomplishment or sense of achieving something or doing something and keeping you motivated with the things that you enjoy in life, really.
Yeah, it's a good point. There's those things that you need some drive for, like it might be building your business, or there's so many, and creating wealth or creating health and those things. But there's also, and he talks about it in the book 4,000 Weeks. Is it's okay to just do stuff just because you love it. And for me, I just love to do those things. I love to take photos, and I love to write, and I think, in a way, like I know there would be some ambition underneath it, but it's also, I think sometimes we just need to give ourselves a bit of permission just to do what we love. Like I heard this story about Rod Stewart. He's obviously a singer. He's been super successful, and his hobby is model trains, and he just loves it. And we all have those things that we really love, but I guess life gets real busy, doesn't it? You have your family, your friends, your work, you've got your mortgage, whatever it is, and you kind of think, oh, I don't have time for that thing that I really just love. We even call it like a guilty pleasure, as if we should be guilty about doing the things that we love. So I think, sometimes we just have to do them just for the sheer love of it, yeah.
Yeah, no, I agree, mate. And I think, as we get into midlife, that's a common sort of thing. Like we always see ourselves as so busy with work, busy with family, maybe busy with aging parents, maybe busy with so many different things. And it can be hard to allocate that time to our health. And that could be physical health, but it can also be mental health. So those hobbies or those activities that we have as a kid that we just let slide, I think it's so important to reconnect with some of that sort of stuff and find what sort of drives us. I'd like to maybe take that conversation and sort of apply it to, your practice now and how you work with your clients and stuff like that. I dare say a lot of the people you work with are in their midlife. What sort of struggles, what sort of things are you seeing, with your clients?
Yeah, we did an audit on our numbers a year or two ago and looked at the most common type of patient that came to the clinic, and it was mid-40s. It was that sort of, when I think that's a time when people, if they maybe haven't, or I guess like you said, we've all been busy. A lot of people doing office jobs, desk jobs, maybe not doing the type of exercise that they'd like to be doing. They start to present with those classic things that when you get to your 40s or mid-40s, you start to need your reading glasses. Maybe a few greys start to appear in the beard. The aches start to appear a little bit in the joints, and maybe a little bit of aches and pains around the body. So that is a really common time for people to come in. But I think what I've definitely noticed over the last 3 to 4 years is that what's been driving a lot of it is stress, anxiety, and nervous system dysregulation. I think, when you look at the nervous system and the amount of stress people are under, like you said before, with all of those commitments, family, aging parents, work, career, business, you put all that, it's like you've got all these plates spinning, and at some point something's got to give. And I think for a lot of people that's their health, because when, unfortunately when people get into that burnout territory, or, they've spent so long focusing on other things like their work and their business that they haven't focused on their health. For a while, the health sort of knocks on the door and it whispers a little bit, and then sometimes it starts screaming, and saying, "Hey, look at me." And I think it's often pain that drives people to that point, isn't it? One of my coaches calls it a snap point. People get to a snap point and they say, "My God, I just can't keep. If I keep going down this road, we know where that road goes. You've got to make some changes." So, yeah, it's a big one. That's a key time of life where people's other quadrants, particularly health, sort of say, "Hey, come and check me out. Come and get reacquainted."
Yeah, exactly, mate. Like you say, you can only keep those plates spinning for so long, and if you've got so many to keep spinning, at some point in time, they're going to start to come crashing down. In terms of working with your clients, when let's say you have got clients that are coming to you in that state, like where do you even start with a client like
that? So the starting, look, medicine's really, comes down to 3 processes: it's history, examination, investigation. I think I've always said sort of 90% of what you need to know comes through talking and getting the history. So, but the difference is in functional nutritional medicine, we kind of sometimes ask a few different questions to what we do in traditional. So when you know your medicine and then you learn your environmental and nutritional medicine on top, you sort of, you work out where you need to go. And by getting that story, like you said before, the first question is what do you want? What are your wishes? And then if I know what that is, sometimes if you've been doing it for a while, if somebody tells me there are three main issues, sometimes straight away it's like a binary system. You know which way we need to go. And there are certain patterns. I think a lot of whatever career you're in, whether it's you're a chess grandmaster or a doctor or whatever, when you see certain patterns, you sort of recognise which shape that is, and kind of where to probe. So I spend an hour with a new patient for that reason, because there's a lot of levels to get through. There's the historical stuff, what's happened in the past. That timeline in medicine is really important. If somebody says, I've never been right since, for example, my story, I've never been right since this happened, or, for a lot of people, it was, I was really sick with a infection in hospital and I had four days of intravenous antibiotics and I haven't been right. The clues start to come, and then it's a bit of a game of detective work to go, okay, let's start looking down this road. And then you examine them. For me, examination, I've got that down to a pretty quick process where I just go through, I look at the hands, the nails, the tongue, the heart, the chest, the usual things. And then you're using that to sort of get some new ideas, but also try and confirm the ideas you've been sort of working on in your hypothesis. And then there's a bit of a movement to just sort of test everything in functional medicine. I'm sort of not so much down that route anymore. I think the best use of a test is to confirm what you're already thinking. Sometimes tests, it can be good to if someone's really sick, to do some shotgun testing and look at everything. But I think really 95% of it is in those first two steps: history and examination, and then doing the appropriate test to find out what you're dealing with. And then the work really begins, yeah?
Yeah, incredible. Yeah, I like it. I'd like to circle back to testing, but something interesting you said there is you say, like, you look at clients' hands and feet and tongue, all that sort of stuff. Like, what are you looking for there, and what are some telltale signs?
So, the nails and the skin, give a lot of clues as to someone's nutritional state, because they need certain amounts of nutrients. So you can look at somebody's hand and see how much protein requirement they might need from their tissue, pulp recoil in the nail. The tongue can look at, very commonly I see people with a yeast overgrowth in the gastrointestinal tract. That's, one of the things that in medicine you're sort of told that things like candida are just like a complete fallacy, but in reality, when somebody's got that, they just describe classic symptoms. They say they eat sugar and alcohol and they get brain fog, and they feel lousy, like they've been hit by a truck after they've had 2 beers. They've got a coated white tongue. Their nails are funky with, fungal changes. And if you treat that and you get them off sugar and alcohol for a while, they get better. So, there's a lot you can tell from examining someone. I think the gut's a really important exam. I see a lot of people, as with sort of gut ill health as their primary thing. And when you know what you're looking for, like I can just probe into that area of the gut that's the small intestine, and people with small intestinal issues and bacterial issues in that area, their guts feel the same. They're very tender when you probe down there. So there's a lot of clues there, and I think that's kind of part of the fun part. Is like it's a bit sort of Sherlock Holmesy, to go, okay, that's what I love most about the job. It's like every new person that comes to me is someone with all of these dreams, aspirations and wishes, but their health is kind of like, holding them back a bit, and we get to like find out what it is and help them to get better. So
yeah, excellent. Yeah, it's such a puzzle, isn't it? And like you say, there's so many different pieces, like the history, that information that's there, the assessment that you're doing, and then digging further into those tests. Obviously gut health is a big thing. How many people that come to you have underlying gut issues, do you think? What percentage?
Well, my first thought was 100, but
That's what I thought too, probably.
But in a way, I kind of became the gut guy over time. Just I don't know, I don't ever remember how that happened, but I guess as you get interested in the gut, and it's such a key part of functional medicine, nutritional medicine, as Hippocrates said all those years ago, well, somebody said it, all disease begins in the gut, and we see as a primary driver of disease inflammation, and if your gut's obviously not happy, that can be a huge driver of inflammation. So I would say for my practice, the gut's probably a significant part of the story for 50% of people. Yeah.
Yeah. I don't even say it's higher than that, but I'm speaking from working as a personal trainer and just seeing the clients that I worked with in London, and just the telltale signs of
Yeah.
gut health issues. Such a high stress, high pace, go environment. And me personally, like I had gut issues, and I put that down to overtraining and stress. Like
Mm-hmm.
there was during my time where I was competing in marathons and triathlons and just putting in far too many hours of training, and telltale signs, diarrhea, bloating, just things that weren't working for me. And it's easy to ignore. I think we just accepted, okay, it'll fix itself. It'll be fine. And it's not until my health really started to go backwards that I was like, no, I actually have to start changing my behaviors. And one of those behaviors was training. Like I needed to rethink what I was doing in terms of my training. Is this healthy? Is this really ticking the box that I need it to be ticking? Or is this actually having a negative impact on my overall health? So I can definitely relate to that in terms of the gut stuff. What sort of gut testing would you go to if a client's showing signs of gut issues? Where are you going to start, or that's still going to be very independent depending on history and that assessment?
Yeah, so like when it comes to the roles of the gut, obviously the gut's got a lot of roles, and we're still learning lots about it, but one of its primary roles is to digest and assimilate food. So if your gut's not working well and you're not able to digest and assimilate nutrients in a fashion that allows you to be at your best health, then you're going to start to show signs of nutrient deficiency. So a couple of key ones. If we zoom out a little bit, let's just take B12 as an example. If B12 is a super important nutrient for energy production in the body, for brain and nerve cell function, and a lot of other things. So, but it's only absorbed from a small section of the terminal small bowel, what's called the ileum. So, but you also need stomach acid to break down the foods. You need a product from the gut called intrinsic factor to bind to it and then absorb it later on. So there could be problems at multiple steps on that pathway. But if somebody's low in B12, their whole function of their body, because they don't make energy as effectively, or you need it in that methylation cycle as well. If you don't perform those tasks very well, you can have a lot of problems. So I think one of my first point of calls with someone with gut problems is to assess their nutrient status. And again, if we just focus on B12, there's lots of nutrients. You've got your macros, your micros, obviously your vitamins, minerals, all of these things. But if we look at just B12, there'd be a whole lot of clues on somebody's pathology of their B12 without even sort of looking at a B12. So the size of red blood cells can get bigger. We call that the mean cell volume. And if someone's got a B12 deficiency, generally the cells get larger, yeah? So maybe the mean cell volume, instead of being 90, might be 98. So that would be a potential clue, although it wouldn't be the only cause of that. They might, they might have a deficiency of other key nutrients like zinc, iron, and even protein if people don't digest well. So, this is one of the challenges for doctors that do this. Is Medicare is kind of, sort of set up to treat ill health, and certainly doctors should be aware of B12 deficiency, but a lot of doctors, we talked about this, in terms of optimal ranges. Some doctors would see a B12 of 180, which to me is on the very low end of the normal range, but you don't want to be on the low end of a normal range for a nutrient that's as critical as that. And anything lower than say 200 needs attention. I'd say, we like to see it we like to have some resiliency and some redundancy in that. So it's not uncommon that we see people that are running in sort of these deficient territories and they just haven't had it addressed. They might have even been checked and they haven't had it treated. So nutrients would be the first place I'd look in terms of gut health. I'm
Yeah.
always I'm always really it's really important to rule out gluten sensitivity because I mean, we could talk for a whole episode on gluten, but the bottom line is if there's celiac disease where you've got an autoimmune reaction to gluten. There's normal where you can eat gluten until the cows come home, and there's a lot of people in that in-between group who can have problems with gluten or be sensitive to it without being celiacs. And that's another thing I see a bit of is these low levels of gluten antibodies, and they're told, oh, you don't have celiac disease, but when gluten intolerance is there, you can have issues with things like leaky gut permeability, and if that's going on, you're going to be more prone to inflammation and all the side effects of that. So I like to look at that. I think it's important people get gluten checked if they're reacting to it. It's important they get that checked out before they go off it because we don't want to miss celiacs. If you miss a celiac and people are just having a bit of gluten, that's not great for them at all.
Yep. Yep.
I think a lot of the other tests around the gut might be a little bit driven by each individual case. Things like some people can have a parasite problem. Some people can have, obviously, SIBO is a big one that's talked about where you've got an overgrowth of bacteria in the small bowel, and those guys with sort of irritable bowel syndrome, that kind of bloating, maybe alternating constipation, diarrhea, a lot of gas production, maybe burping and some wind. That can be a problem with the nervous system and the small bowel. So there's ways you can look at that, and I think there's some of the places that I would start looking at the gut.
Yeah, no, it's a good starting place, mate. When you say gluten insensitivity, like what would you test to do that? Like to be able to figure that out?
Yeah, so I think the basic celiac test involves what's called IgA, which is the gut and the sign, the mucosal surface antibody. It's called a TTG antibody, which stands for tissue transglutaminase, an anti-gliadin antibody, which is AGA antibody. Now they're the ones that we have available, but gluten is actually quite a big protein, and it's got lots of little protein. It's got lots of little subunits. So we can't actually test for all of those in Australia. There are labs in, say, the States that can do much more comprehensive gluten tests looking at sort of the smaller peptide elements of gluten. So that's one way to do it. And I think there's a bit of interest in zonulin as a marker as well, of leaky gut. And if zonulin is kind of like, think of it as between the gut cells, and if zonulin's high, it's like the drawbridge opens and the cells are more permeable. So if you've got high zonulin, that's a marker for leaky gut, and gluten is one of the things that can cause a raised level of that. So there are there's a lot more interest in doing deeper dives into gut health with things like digestive stool tests, and some of those panels would have a zonulin on them. So that's an interesting marker for people who might be sensitive as well.
Yeah, exactly. I think it's a very interesting one because I used to always tell my clients, like, you should cut gluten out and just to try it, like give yourself 30 days without eating gluten and see how you feel. And then it's that reintroduction of gluten. It's like, okay, so if you've had a period of time off and then you eat a little bit of gluten, well, what happens? Do you feel bloated? Do you have gas? Do you feel, a little bit nauseous? Like, what are you feeling when you have that? I think just because there's so much gluten in our lives and we eat gluten every day, it's sort of, we don't really pay attention or we don't really see how it affects us. And it's not until we take it out of the diet and then reintroduce it that we actually start to see, hang on a minute, like this is actually having an impact on my gut. Is that something that you try with your clients? Is it some sort of stuff where you can test through maybe not doing tests, but just doing experiments around those lines?
Yeah, that's been a topic of discussion. I remember when I was learning nutritional medicine, I had a lecturer who was, a bit of a Yoda type of character, super experienced, super wise, and she always recommended as doctors that we tested first, because the thing is, if people, the problem is we're always risk averse as doctors. We want to rule things out, and if let's say somebody says I bloat with gluten and I'm nutrient deficient and all of that, and they go off gluten and they go, I feel better, and they never get tested, and then they have a little bit of gluten when they go out for dinner, or but they never actually get tested, and you've missed an actual celiac. There are some potential long-term consequences of that are not nice. So as doctors, I think, that's essentially what we don't want to miss is a celiac disease. That's the bottom line there. Is it reasonable for everyone in the world to go and be tested by their doctor for celiac? Well, it's probably in the pragmatic world. I think obviously that's a consideration. I mean, even before we had blood tests, what did we do? The guy that discovered celiac disease, like this story many years ago, they called it, I think, the banana diet. They didn't know what was going on, but they just realised that if they put people on just eating bananas, they got better. Wow, because they weren't eating any gluten. You can obviously eat more than bananas if you've got celiac, but yeah, it's a really good question. I think that's why there's no easy answers, Andrew, in medicine. It's like, well, I think if you're a doctor and you've got a patient you've got an index of suspicion against potentially a lifelong autoimmune disease, that's when you need to know whether it's important to test it versus whether you can do what we call the low-stress diet. So for us, if we were putting somebody on an elimination diet for a trial, we'd call it a low-stress diet. We'd probably say something like no gluten, no dairy. I'd include no soy, and I'd say no added sugar, and ideally no alcohol, because when you look at there's food allergies, food intolerances. Some of the biggest ones can be gluten, dairy, soy, and obviously sugar is not really an allergy. But if you've got inflammation and dysbiosis or imbalance in the gut, taking sugar and alcohol out is a pretty smart move, even for a few weeks.
Yeah, 100%.
You said you bring them back one at a time, and we see a whole lot of dairy intolerance in nutritional medicine. That again, most doctors aren't really taught much about food intolerances. I mean, they know about a lot of doctors know about peanut allergy because it presents floridly, but sometimes you see dairy present with mucus, postnasal drip, eczema as a baby, tonsillitis, and even constipation and acne as you get older. So there's this classic sort of presentation for something like dairy intolerance, and it's amazing how often it doesn't get picked up. It takes somebody a long time to sort of find out dairy is their problem.
Yeah, that's incredible. And that's like not just like lactose, is it? It's like, and it's not just like whey or casein. There's actually so many different compounds that we can have that sensitivity or that intolerance to in dairy that can cause that sort of flare up, isn't it?
That's right, and then there's that whole thing about A1 and A2. Some people seem to react more to certain types of dairy. So yeah, this is totally where it gets complex. And I think the other thing is there's a lot of people out there that have very strong opinions on what is and isn't a real thing. I mentioned Candida before. Now, 95% of my medical colleagues might think I'm a complete quack, but and it's the same with allergists, and some of them don't think that there's such a thing as dairy intolerance. But I'm not here to argue with anyone. I'm just here to try and help people. And I think, you've got to kind of when you're a practitioner, you need to be really pragmatic about, it comes back to that evidence-based medicine triad. There's the actual experimental and the evidence that's in the literature. There's the experience of the doctor and what they've seen in their career and what they know sort of works. And then there's the expectations of the patient. Some people, everyone's got different experience and expectations. So we want to try and, I think the sweet spot's in the middle where you're sort of working in the middle of that triad and you're doing your best. I mean, it's always good to look at the science, but the science it hasn't tested everything, and it probably never will test everything.
Yeah, I agree. It's like, we're always looking for the study or looking for the facts, but sometimes it's just wise to be curious and it's wise to experiment. And I love that idea of just being able to experiment. Like, just take dairy out of your diet for 2 weeks. Like, give it a shot and see what happens. I think one of the biggest problems I see in the health and fitness industry is, we're always talking about calories in and calories out and going on a deficit of calories and just stick to your macros and all this sort of stuff. But nutrition's far more complicated than that. And if someone's got a dairy intolerance and you're trying to cut calories or you're trying to do this, but they're still eating dairy, it's just never going to be able to help them fix their health. And, there's so many great foods out there. We could talk dairy, we could talk eggs, we could talk, loads of different foods that are are great for your health if you can tolerate them. But then if there's underlying gut issues or there's underlying issues where you've got a sensitivity to those foods, they're no longer healthy foods for you. Like, there's such a big discrepancy between that. And I think that's where nutrition gets really confusing, because you hear people talking about, oh, eat this, it's the best food in the world. I'm like, well, for who? For who?
Yeah. Yeah, that's so true. And, the word that sort of got bandied about, 4, 5, maybe 10 years ago is personalized medicine, or what they call P4 medicine, participatory, like the patient or the person has got to be a participation in their own health. Precision, personalized, in that, the saying is, one man's meat is another man's poison. Like, if you've got red meat allergy, you and I could go out for a steak and a glass of red any day of the week. But if you've got a red meat allergy, that's not going to be a fun night out. There's this movement towards personalizing everything to what's going on in an individual person. To me, that's the only way you can practice medicine, because, like you say, like a lot of those things that people talk about as being healthy, take ferments and bone broths, like they were the craze a few years ago, and to some degree still are, but you're seeing a lot more people now with histamine problems and histamine intolerance. And like you see, it's probably once a month or once every couple of months, I'll see someone going, "Doc, I'm doing everything right. I'm eating all my ferments, my bone broth, but I keep coming out in hives." It's like, okay, let's pull back. We've got to look at individualizing it for everyone. And that's where it takes that time. That's why I spend that time first up, because there's a lot of little clues in there. And I think what you said about food, like when I think of it, I'm always thinking in my mind when I'm seeing a new patient, what are the hidden and invisible stressors? And I think probably food is a hidden stressor, but it's actually invisible, because most people don't ever think about a food as their problem. I'll tell you a story about a patient I saw. Well, actually, it's more than that. It's like my mentor, who sadly passed away about 2 years ago, Carl Fromek. He was one of the sort of founding fathers of nutritional medicine in Australia, and he was an expert on food intolerances. So I learned from the best. And if I ever had a tough case, like, Carl was literally in the next room to me. And there was this one day I had this lady. She kept coming back, and I've tried everything I could think of, and I'd done some tests, and she just wasn't getting better. And so I knocked, like, I'd done that low stress diet, and so I knocked on Carl's door and I said, "Carl, could you give me a hand with this one?" And he came in, and the lady was coming out in this dreadful rash all over her body. It was unbearable. Like, she was literally at the point of wanting to exit, Carl came in, he asked her about, 4 questions. He just sort of stood up and he hovered around her like a vulture, and he just sort of zoomed in, and he was looking at her, and I could see what he was doing. He just he said, what are you eating every day? And she said, "What do I eat every day?" And she said, "Eggs. I have eggs every day." He said, "It's eggs." And the hairs on my arm stood up. I thought, oh my God, it's eggs. She goes home. So I can't take credit for this case, but she come back 6 weeks later, and she was over the moon. All of her chronic dermatitis of 15, 20 years had cleared up, and she had an egg allergy. And it's one of those ones, there's some foods that are not the most common, but they're still quite common. And as doctors, you can go to a lot of doctors, including me 10 years ago, when I didn't pick that case. And it could be an egg allergy all that time. And like I sometimes say to people, Superman can't have any kryptonite in his diet. If he has a little bit, that's it. So some things you've just got to have the ultimate constraint on. And how hard is that for people, Andrew? If you've grown up on cheese and a little bit of yogurt, and you like a little bit of Parmesan, and all of they're beautiful things, but some people will just keep paying the consequences, and they'll have a lot of trouble cutting those things out, even though they're causing a lot of pain.
Yeah, 100%, mate. It's so funny, like the 2 stories you just shared there, like A, about histamine and B, about eggs. I've been through that, experienced both of those. So eggs was when I was doing the triathlon stuff, and I swear I would have had leaky gut 100%. But there was this cafe that we used to go to every morning. So we'd do our PT clients, and then we'd go to this cafe every morning, and they made the best omelette. These omelettes were massive, and they had cheese, and they had bacon, and they had everything in them, and they were fantastic. But we used to eat an omelette every day. And it got to the point where I'd eat the omelette and I'd just feel like I was going to be sick every time. And it took me a little while to get the idea. I was like, you know what? It's eggs. I bet you it's eggs. And I did do a food sensitivity test, and fair enough, it came back with, like, I've got a sensitivity to eggs. And, like, today I can eat eggs, no worries. But back then, when my gut was in that state, eggs would just set me off and make me just feel absolutely horrible, and I had to change that. And then on the histamine front, when I got back to Australia, when I left London and came back to Australia, I met with a PT in Melbourne, and he was into the functional stuff, self-taught. But I think he just had a one-size-fits-all sort of idea to how he could fix people's health. And he knew I had underlying gut issues. And his big thing was, bone broth because it's good for your gut, slow-cooked meat. He put me on a fiber supplement. There were so many things there, but that just made me worse because it just kicked off the histamine in my body, and it just didn't get to the bottom of it. I knew the problem, but I just really couldn't figure out the solution and how to do that. And it wasn't until we started working together and we started working on healing my gut and figuring out the cause of my histamine that things really started to improve. But it was just like I said before, maybe it's that hope. It's just like, I've got to keep trying stuff. This didn't work, but I gave it a shot. What's next?
Yeah.
Okay, who can I do next? Who can I go to? Who can I learn from? How can I grow? How can I change? And that is a big mindset switch for a lot of people, I think. We can get stuck in that belief system around a certain diet or around a certain solution, and it might not work, but we've just got that unwillingness to change. I'm curious, like when you work with your clients, obviously there's this medical approach that you've got, and it's coming from, these tests and this data and this information, great. But at the end of the day, there's got to be that lifestyle change, or people have got to be willing to make that shift. How do you find most clients go with that? When you ask them, okay, let's say go on this low stress diet, or let's say cut out eggs, or do these sort of things?
I think it's that's gotten a bit easier over the years, and a part of it, to be honest, is how much you pay. Like if you don't pay anything to go see a bulk billing doctor, it's easy not to take the advice, So what do they say? The most expensive advice is free advice. And as your rates go up a little bit and people start to listen a little bit, I think the more in some, and this is not a talk about money, but when you pay a significant amount to go and see someone that's trained and highly experienced in their field, you're much more likely to go, okay, I'm at that point of, we'll call it a snap point, yeah? I am ready. Yep. I am ready to make the change that I need to make to experience better health. And so I've worked a lot of years with a coach locally who's a friend and a coach who he taught me that term snap point. And a lot of the time when somebody's not at that point, so then in terms of the change cycle, maybe they're not ready to change, your job really is to get them to that point. So how do you get them to that point? Well, you can wait for people to come that are ready to change, and they're the ideal people to work with, whatever you're doing, because you're going to get there a lot quicker. If somebody's not ready to quit dairy, they can come and see me, or egg in that instance. If they said, no, I'm not going to stop, I like my omelettes, like we could work together for 20 years and I couldn't help you, So you become more selective in a way over time of who you can work with. And I think it's almost implicit that when you come to see me, I rarely get anyone that comes and says, occasionally you do. I just want to know what's wrong with me. I don't want you to tell me what to do. I just want to know what's wrong. And that's fine. Like, I'm happy to do that. But occasionally, this is where it gets a little bit more challenging, is when, let's say, somebody for moral and personal reasons or spiritual reasons eats a certain type of diet, and they're very fixed on that dietary approach. And I find that that's actually an underlying cause of their nutrient depletion, their gut health, and their osteoporosis, for example. And they don't want to change. That becomes a lot more challenging to work with. So, again, but when you look at that evidence, coming back to the evidence-based medicine triad, that patient, I've got my experience, but that patient's also got their expectations and their own hierarchy of values in life of what is right and wrong for them, okay? So that's where you need to really work with people, I think. Like, I'm not going to judge someone for their their beliefs. Like I know, I realise I'm old enough now to realise that we've all got different values in life.
Yeah.
But, you know, sometimes when you meet in the middle and you work with someone and you educate them over time and you explore these things in a fashion where you're not antagonistic, because you see this argument now, don't you? You've got the carnivores here and the vegans here, and they're just butting heads. It's like two, you know, antlers crushing in the middle. It's like, you know, but as I said to my mate Andy, another personal trainer on his podcast, it's like every coin has got three sides. There's one side over here that's got strong beliefs, another side here with strong beliefs, and they can both find the confirmation evidence that their argument is right. But if you stand on the middle of that, on the third side, which is the edge of the coin, and you can be pragmatic and open about all possibilities, then when you're working with someone, I mean, you know, what we do know is that person, that individual who is suffering wants to feel better. Yeah, that's what they want. So, yeah, in terms of the tactics, we got to use whatever tactics we can to help them get there. And sometimes it's diet. Yeah.
Yeah, 100%. I like the way that, you know, you've obviously got clients that are in that state of change. There are many different, obviously, states of change, but the clients that you're working with, if they're willing to invest that money, they're obviously in a position where they're ready to make a change, or hopefully they're ready to make a change in their lifestyles to be able to support that, which is fantastic. It's interesting when you talk about the diets, because, you know, we've got keto, we've got carnivore, we've got vegan. There's so many different things, and I think it just confuses the landscape. Like, people are just so, oh, look, I heard this podcast about this guy who went and he did keto and he got great results and he achieved this, and now I'm going to go keto. But then, like, they've got underlying gut issues and they can't digest fats properly, and then they're trying to eat a high fat diet and it's just like not working for them at all. And it just really confuses people. And I'm sure you get a lot of that as well. Like, people come to you like, oh, I'm on this diet and this, that, the other. How do you navigate diet? Let's go into nutrition a little bit more. Like, how, when you start to talk to someone about their diet and you know that you've got to make some changes, maybe from the tests and stuff that are going to come in, because I think people are very protective of their diet at times. So it could be those belief systems that they've got. Like, how do you sort of walk into that or recommend people start to make changes?
Yeah, I think what you said is there is a lot of confusion, and that confusion ramps up by a factor of 10 and 100 when people have got, you know, gut issues, because they become, in a way, sort of fearful of food. And, you know, when you've got sensitivities to histamines and salicylates and these things, you just don't feel safe, and then your nervous system's on, and it's sort of on all the time. So, look, I think essentially there's a lot of data, there's a lot of, and I think we kind of know, in essence, what the problem is. The problem is ultra-processed food. So if across the globe, if we could just get people to eat a slow diet, seasonal, I mean, ideally, seasonal, local, organic, whole foods, like basically real food, not something in a packet or, you know, it's been ultra-processed, that would probably, I mean, that could cut the global health budget by 20%, just that, maybe more, who knows. But, you know, that's a big industry. And then when you start to look at, you know, those industries that are some of the big players in the global capitalistic markets, they've got a lot of clout, and they've got a vested interest in us eating crap. So this, when it comes back to what you said about change, we need to vote with our forks, as they say, and make that decision for ourselves and our families. And I think we're slowly getting there. But we're still fighting against this environment, this food and global environment, where when you look at what makes people change, yeah, the mindset can be right, but if you're in an environment, like if you're driving up the highway, and I was coming to see you wherever you're at might not want to.
South Australia, mate, over in Scale Bay at the moment. Big drive.
If I stopped at a servo, like if I was going up to the airport and I had to pull over and get something to eat, man, it looks like it's just not even, you know, consumable produce. And I just, you know, so we're in this world where it's actually can be hard to actually insert, like an airport's another good example. It's pretty hard when you know, going through an airport to not be surrounded by Krispy Kreme donuts, you know.
Yeah.
So look, I think it's essentially, if people could cut down ultra processed foods, eat whole foods, obviously personalize it in a certain way to get the right amount of nutrients. But I think, in a nutshell, my research and my clinical experience suggests that we need a certain amount of protein for growth, two, for satiety, so that we hit that hunger switch so that we're not craving carbohydrates and fats through the rest of the day. So I think we need to be protein aware, and if you're a plant-based eater, you need to be making sure you're getting adequate dietary protein to do those things. So the other thing that's probably, we talk a lot about what to eat. I think there's more and more interest in when to eat, and this idea of like we're in this caloric avalanche of our world where we're told to eat 3 meals a day and snack between meals, and this is what some people still tell diabetics with type 2 diabetes, is to keep eating carbohydrates. But I think there's more and more evidence to say that I don't think our paleo forefathers necessarily sat down for 3 meals and 2 snacks a day. I think it's okay to do a little bit of fasting if you know how to do it and you don't go too crazy. I think people that are learning to do things like that need to do it with some sort of supervision, because there are potentially certain risks for things like extending your fast. But this idea, I think we're in a world where we're just saturated with calories and particularly carbohydrates that can drive that insulin resistance, which can drive a lot of other disease. So maybe sometimes we need to eat a little bit less often.
Yeah, it's an interesting idea, mate. I like what you said about protein. I'd like to circle back to that a little bit. So we're talking about protein requirements. Like, what sort of level of protein are you suggesting to your clients to be eating?
Depends a lot on, again, what their goal is. So some people might want to build muscle, or some people might be an athlete or undergo a lot of stress in their life where they need more muscle. Yeah. So those people are probably going to need more than somebody who maybe has another goal. So, there was a study, or not so much a study, but a review article came out a few years back called the PROTAGE study. And it was kind of a group of experts who got together and looked at the protein recommendations, because before that there was sort of this blanket, rule. I think the thought was about 0.8 grams of protein to 1 gram per kilo per day, split across 3 meals. And when they looked at that, the thing with these recommended daily intake, RDI, is they're generally set to be the minimum amount to stop you from getting, say, scurvy or something like that. I don't see a lot of scurvy, but I've seen one case at least of scurvy, which is vitamin C deficiency. Yeah. So the bottom line is you need to get adequate. And for the summary of the PROTAGE study was, maybe depending on what your goal was, maybe you need closer to 1 to 1.4 or 1.5 grams per kilo. So that's actually, when you look at that, it's actually a lot more protein than people eat. But there is a big debate around protein, because the longevity scientists, a lot of research from longevity research suggests that the more you restrict certain things, including calories, but also potentially protein, the longer you might live. But then it becomes a trade-off. Do you want to live a lot longer, or do you want to live healthy, stronger and vibrant life? Depends on what your outcome is. Again, there's a few other things to say about protein. Is I think people need to get advice from their docs, and particularly around kidney function. I think the body eliminates protein through the liver and then it's excreted through the kidneys. So there was a sad case a few years ago of, I think it might have been a woman who was taking a lot of protein supplements and training, and she had a metabolic mutation in her protein genes that she couldn't eliminate, and she died, I think. Now, that's not a common, those inborn errors of metabolism, they're not common, but, kidney function, everyone needs to be aware of their basic parameters like kidneys to get a really good idea of what's right for them.
Yeah, 100%. I mean, looking at the research or looking what I've looked at in terms of like protein intakes, like, okay, if you've got underlying kidney issues or you've had kidney failure, okay, you've got to be really cautious about the amount of protein you're eating. But if you've got healthy kidneys, like you can be pushing the higher margins of protein and reaping the benefits from obviously protein. And we're talking about quality protein, we're talking animal protein, complete amino acid profile. Um, it's all the other nutrients that comes with that. Like, red meat's got so many other key nutrients in the diet, whereas plant-based protein, like the amount of food you're going to have to eat to get the same level of protein is just going to push your carbs way up. So I don't know. I'm a big fan of the protein and trying to push the protein a little bit more. And you talked about muscle loss and the importance of muscle. Like if people have got the goals of putting on some lean muscle or maintaining that muscle, I think that becomes even more important as we age. Like as we get into our midlife, our ability to maintain muscle or build muscle starts to slow down. So don't we want to be doing everything in our powers to support that muscle mass? Like, what are your thoughts around that?
Oh, that's exactly the conclusion that they reached in the ProTage study, was that when we get to around 60, 65, and then the hormones are dropping off. So in terms of the growth pathway in the body or in the cell, there's a switch called mTOR, and mTOR's got a number of inputs, which include protein, particularly certain types of amino acids, energy in general, resistance exercise training, and other growth factors like insulin-like growth factor and maybe growth hormone. I think that's some of the inputs. So as you get to say 65 and your hormones are dropping off, relatively you need more protein to stimulate mTOR, which stimulates muscle protein synthesis, MPS. And yeah, that from memory, that was one of the major conclusions, is that people that are getting into that stage of life need relatively more than what they did previously. So I think when it comes to that sort of, if we were being pragmatic, I think, again, unless you were sort of, if you're aiming on being a bodybuilder or having muscle, you're right, you need to have the raw ingredients of muscle, which is muscle protein and amino acids. But yeah, I think this is where, the guys like David Sinclair and Walter Longo, they're going to give another version of events. But I think, in general, in practice, most people I see don't want to be bodybuilders. They want to be healthy, and they want to have strong bones, and if they don't want to fall over when they're 85 and break their hip. So that's when we need to pay really close attention to what's right for those guys. But I think you're right. There's a well-known mechanism about why we need to focus more on protein, particularly in the back third of life, because they call it because of hormone resistance.
Yeah. I just think there's so many benefits. We look at insulin sensitivity. Well, the most insulin receptors are on muscle cells. So the more muscle cells you have, the better the insulin sensitivity. Muscles take up glucose. So the more muscle we have, then the bigger the tank to take up glucose, keep your blood sugars level. We obviously know muscle's metabolic. And we think about muscle, I suppose, as locomotion. Muscle helps us move, but it supports the skeletal system. And if you've got low muscle mass, then the chances of breaking a bone or falling over or getting injured are obviously increased. I just like there's just so many benefits of having lean muscle. And I think our society's so focused on fat loss and trying to lose weight and cut calories and eat less and move more, that we overlook, well, what's the cause of that? Why are you overweight? What's going on there? Is the metabolism slow? Have you actually lost a lot of muscle mass due to such a sedentary lifestyle? And the best solution is actually, or the root cause is a lack of muscle mass, not a growth of fat cells. So let's get the resistance training in. Let's get a high protein diet. Let's get everything where we're ticking that box just to start to get that muscle mass maintained at a minimum, but hopefully grow if we possibly can. And that'll probably help protect us from a lot of illness, a lot of disease, and keep us healthy and strong and vital for obviously as long as possible. So that's one of the things I'm just adamant about, but maybe that's my personal training bias just coming in.
I don't think so. I think what you're saying is completely not just valid, but I think, when you look at, let's just take my profession, medicine, and even functional medicine, there's certain things that muscle's coming into the discussion a lot more now, but I think muscle has been undervalued, and even only 20 years ago, it was just a thing that moved a joint or got us to move around. Now we understand, these things like myokines and the effect that they can have even on the brain, and like you said, insulin and all of these other things. It's much more than just a chunk of meat that moves us around the world. It's got this very powerful effect. So, yeah, this conversation, it's a very important conversation to have. But the challenge is, and I know that this is what your challenge is at work as well, is when people have been conditioned to a sedentary life and maybe not enjoyed sport for a long, long time, and they're sitting at a desk job, is instituting the change and getting them to places that are going to help them build muscle. And I think this is a big part of our challenge as the health profession, is we know what works, don't we? We know, what we've said today is healthy diet, low processed foods, and build some muscle. It doesn't sound that difficult, but in practice, that's what we need to now get across the whole population, not just our clients, but the whole lot. So it should be starting, this should be the information that's available to young people, to be able to and navigate their own journey, their own health journey through life, so that they can stay out of the hospital system and stay away from disease. But, like what we sort of alluded to it before, there's a whole world of vested interests that maybe have an interest in you not doing those things. And I think that's just the reality that we need to accept. But as individuals, we need to make our own choices in our own lives to take control, because as John Demartini says, if there's an area of your life you're not empowered in, somebody will have power over you. So if you don't take power over your finances, you will be overpowered, like someone will have power over you in the monetary system. If you're not empowered in your own healthcare, someone, you're going to end up going into the mainstream sickness system rather than the wellness system. And you could say it in any area of our life. So that's where it's up to you, me, and all of our clients, is to take the power back. Yeah.
Yeah, I agree, mate. It's a hard thing, like you say. There are so many forces working against us in our modern society and that big food industry. Yeah, I think it's just important to have a growth mindset and not a fixed mindset. Like, we can get so stuck with the blinkers on in our belief system and not be willing to just look outside of, what we've been stuck in, I suppose, or the processes or the beliefs that we've got. And it can be hard to make that change, but I do think it's important. One thing that you said there, and I think was good, it was like, we talk about exercise, and some people that maybe have been sedentary and don't want to get back into exercise. I think it's like, what you said at the start, and it circles back nicely. Like, if you love to take photos and you love to write, it's just like being able to find something that you enjoy doing, whether that's going for a walk, whether that's doing CrossFit, whether that's just going to the gym and working with a personal trainer. Like, I don't think there's necessarily the best training program, just like there's not the best diet. But what works for you? What's one small change you can make today that's going to push you in that direction to help get the ball rolling? And usually it's got that snowball effect. If we can just do one little thing, like you say, okay, if I sit down and write for 20 or 30 minutes a day, well, that's a lot of writing. But I bet you there's times where you write for an hour or you write for 2 hours, because you just get that momentum going and you've just sat down and you've committed to starting or just making that a habit or a practice. Is that something you'd agree with?
Yeah, although I also do apply the constraint of I know that if I write every day for half an hour, then I'm not going to not write the next day. So in a way, and I'm learning Spanish on Duolingo at the moment, and like some days I will binge and then I won't feel like it the next day. So I actually limit what I love to do to that. But that's just me making sure that I keep the streak going. Yeah, like as Jerry Seinfeld says, what's the secret? What's the secret of writing a joke every day? Don't break the chain. Like, you got to build the streak. You got to do it every day. If you want to get the results of something, it helps to do it consistently every day. But I think the good news on movement, and they've shown it, is I think a lot of people get scared off by, you've got to do 2-3 hours of moderate to intense exercise every week, and then people go, oh my God, 3 hours. I don't have 3 hours. I'm busy. So, in the book Atomic Habits, and there's some really good habit books, but I love Atomic Habits for a few reasons. He talks about minifying it. And that idea of minify is actually okay, there's studies out there to say something called VILPA, which is vigorous intermittent lifestyle associated physical activity. These are like, oh, take the stairs instead of the escalator.
Yeah.
Carry your shopping up the stairs rather than get the elevator. These small things that we can do every day that get the heart rate up a little bit, they actually, when you compound those things over a life, they actually equate to better health. And yeah, I think you're so true. It's so true about the sedentary lives we live. They talk about the blue zone diet, but the guys living in blue zones and the ladies in the blue zones, they're doing a lot more than eating whole foods. They're, climbing the hill to milk the goat and to, have meet up with their friends in the afternoon and have a chat about the day and getting good sleep. And they're doing all of these things. They're not sitting down for 8 hours at a computer, most of them. Yeah.
Yeah, no, exactly right. And I think, you hit the nail on the head there too. It's about not overdoing it. It's about being able to keep the motivation, the willpower going and enjoying it. Because I think that's a common mistake too. We go through stages of like, okay, I'm going to go on this diet and I'm going to cut calories and I'm going to exercise every day and I'm going to train twice a day and I'm going to do all this sort of stuff. And it becomes too overwhelming and it does have negative impacts if you go too far. I think that bell curve, it's trying to find that sweet spot and make it work, and just small steps in the right direction. Just how powerful that can be. Like I say, just take the stairs. If that's where it starts, that's where it starts, and it can make such a big difference in longevity, health, and vitality, and just so many different things, mate. So, yeah, great advice. Yeah, I like it.
Did you ever read the book by Steve Pressfield called The War of Art?
No, I don't think I've picked that one up yet. No.
There's a book called The Art of War, and his is called The War of Art, and it's a brilliant book. Like literally, it will change your life if you've got resistance, because it's a whole book about resistance. Like this, I ought to, most of us, if we're being honest, in one area or more of their life, they have a resistance. They kind of know what they want. Like, I want to be healthy, but there's resistance to doing the things that are going to get you in that path, in that direction. And he talks about the only thing that stands between you and doing what you want to do is resistance. It doesn't matter what the challenge is. So if you read the book, which I think everyone on earth should read that book, and probably Atomic Habits, because if you use the skills of those two books, you actually see where your own resistance is. So if there's something, let's say you commit, like I'll use my example of, I want to write, so I commit to write every day. Do you think there's days when the resistance came up for a while, and it was that inner voice going, "Oh, you got nothing to write about today." The voice is there. We've all got it. It's like the voice of the inner critic of resistance. So when you actually choose to commit to something, like a training program or like a boot camp or whatever it is, your resistance is going to come up, and that's almost as big a part of it as the actual program. Because if you can understand yourself and what's those there's this idea now in psychology of IFS, internal family systems, that we've got these parts, and there might be a part of you that wants to be a sloth and not do the exercise, and that's fine, but you got to get to know that part of you, and you got to work with it. Because if you're really hard on yourself, and you say, "Oh no, I'm just a lazy person," and it ends up bashing your self-esteem up. So you got to recognize the parts of you, and you've almost got to enlist them in the process, yeah. Because even the sloth likes to swing from the tree occasionally, and grab, do certain things. It might not be all day, every day, but maybe for 5 minutes, it's got to move from one tree to the next. So we've got to use these parts of us very sensibly and get to know them.
Yeah, 100%. It's that self-compassion. Like, it's just being able to find that self-compassion. It's so funny, like, if you've got a friend who's suffering and they're telling you how hard something is, we're really good at being compassionate towards someone else and understanding and supporting them. But to ourselves, like, that self-compassion is sometimes a tricky thing. And I like the way you talk about resistance, because I think, like you say, we all have resistance, and it's being able to find those points of resistance in our life. Like, what are we resisting? What are we holding back against? And why are we holding back against? And what might happen like if we do start to step into that resistance and look at it from a different perspective, or to try and understand it a little bit more. But yeah, I definitely think that self-compassion is a big thing. So many people I have worked with have just, they beat themselves up, they miss a training session, or they don't hit a new PB, or they don't do a certain thing, achieve a certain thing with their health goals. And it's really easy to beat themselves up, but they don't celebrate the small wins, like the little increases or the little improvements, or the day by day, just turning up, just showing up. Like that's such a big win. And it often gets overlooked, doesn't it? And that inner mindset and being able to work on that's so powerful. I think sometimes the brain's probably the number one muscle we need to train, or we need to work on first to overcome
Yeah.
all these hurdles and obstacles. Yeah.
Yeah, no, that's when I, last year I ran a metabolic course, so it was over 6 months, and we did 6 different modules, and I did at the time I didn't know where it was going. I was sort of creating it as it went, but it turned out that to keep it really simple, we called it meals. Like this is what the focus on it was: meals, which is we've talked about; movement, which is we've talked about; and mindset. They were the big 3: meals, movement, mindset. And if you can focus on that. There's a lot of talk about trying to, what supplement should I take, or, what test should I do, and all of this. But if you're just bringing it back, meals, movement, mindset, and if you can do that in an environment with some mates or community and meaning, if you have some meaning in your life and that you're working towards something meaningful to you, which is something that's high on your values, then you can create a life,
Yeah.
So I think that's, if I brought it back to those simple 5 M's, that's kind of the foundations for me of health creation, because you can have all of this stuff, you can have good health and you can have all of these things, but if you don't have any meaning in your life and you feel like you alluded to it a little bit earlier as the sort of, and we haven't talked about it, but mental health, if you don't feel a sense of meaning and some sort of value of yourself in this world, then you can still be unhappy, and if you're unhappy and feeling a sense of that, then everything you've got, it doesn't sort of make you feel any better. So yeah, I think we need to think more about that. What brings us meaning, like I think in the world, we've all got a different thing that brings us meaning, but if we can find it and try and bring it into our life and nurture that and commit to that, which means spending some time with it, then a lot of that other stuff that is out there distracting us, like for some people it's TikTok or Instagram or whatever it is, and you spend doing more time doing what's meaningful to you, you find that over time your life actually becomes a little bit more better and a bit more enjoyable.
Yeah. I think this comes back to the shift that you talked about before too. We get to that point in our midlife, and it's like maybe we're not chasing career anymore. Maybe we're not chasing, a certain weight on the bar. There's so much happening in that point, and we get to our midlife, call it maybe midlife crisis. But you're trying to look for some sort of purpose. Like, what am I going to do with the next part of my life? How can I contribute? How can I give back? Like, I think they're interesting questions to sort of ask, aren't they?
I was thinking about that term when you talked about sort of midlife, is that, what happens at midlife? And then I actually thought about that, the midlife crisis. And, I think we don't necessarily, I mean, some people do need to leave their career, don't they? They need to make a fresh start. But I think a much more gentle way to do it is to go, like we said before, what do I want more of? And just spend a little bit of time, focus more on what you want. And that might mean, spending a little bit more time not doing something else that you're doing over here. So it's sort of moving your life in the direction that you want. And over time, you end up a lot happier than when you're doing a lot of things that you really don't like doing in your life. Yeah. Sometimes we need to do the things that we don't want to do. Sometimes we need a certain amount of that. But in general, life, that we need to have an experience of life as well, where we've got one life, haven't we? We've got one crack, This isn't a dress rehearsal, as they say. This is the real game. The game's on right now. And if we get to 40, coming back to 4,000 weeks, when you get to 40, it's half time, isn't it? If we live to 80, we're at the half time mark. So it is time to sit back and reflect and to get really clear on what it is you love and what don't you love and what do you want with your health. What changes do you need to make, Do you need to enlist somebody like a trainer? And I think it's a great idea for people when they're getting into a health program, especially when it comes to physical activity. I do see a lot of people that just go for it and get an injury or a tendonitis or damage their shoulder. So doing it, I know a good trainer will know which order and which way to progress people without hurting them. So sometimes you just need to, open the wallet, so to speak, and pay for the resources and invest in yourself. Like that's an investment to do that.
Yeah, I think all through this conversation, mate, you've had this idea of like the goal. It's like, what do you wish for? What are the goals? What are you working towards? It's that sense of direction. It's that clarity. And I think I agree with you there. It's really important to know that direction. Like, where do you want to get to? Because, we have got the access to be able to do so many things in our life, and you can do so many different things, so you can choose. But at the end of the day, we have to make sacrifices. You can't do everything. And if you don't have that goal, or you don't have that purpose, or you don't have that sense of direction, how do you know what to sacrifice and what to keep? I think it's just the clarity is just so important. And that's with your health, that's with business, that's with exercise. I think it's with everything, just to have a sense of direction. And it can change, and it will change. Like my direction or what I was doing in my 20s is very different to what I'm doing now in my 40s.
Yeah. Yeah, that's, there's a lot, I think it does change for sure. Mine definitely has changed as well. There's a lady, I think her name is Bonnie Ware, and she's an Aussie, and she was in the palliative care setting, and she got to talk to a lot of people that were dying, and she actually wrote a blog post a few years back called "Top 5 Regrets of the Dying," and number one was I regret not living the life that I was meant to live. Because people are often living somebody else's dream. People have steered them in one way or whatever, or whoever that might be, and inside them there's sort of this part of them that goes, no, there's something else for me. And sometimes we just need to give ourselves permission to live the life that we deserve to live for our own self. And I'm not suggesting people quit their day jobs right now, because it's that process of change, evolution and growth, like you said. We need a lot of self-compassion, but it's also change is actually, it's a really sacred process as well. So people need to have good people around them that they can bounce these ideas off, maybe a group of people or a mastermind, whatever it is, or maybe you need to go and see a therapist. But if you've got someone to talk to and work your way through life like that, then you can get closer and closer to the, quote, authentic life that you really came here to live,
Yeah, awesome, mate. Mate, we could go on for hours. Like every time we have a chat, I think we could just dig deeper and deeper. There's so many things just coming to my head right now. But, mate, it's been great to chat to you. I think there's so much value in everything we've just covered there. Is there anything else you want to add before we finish up?
I reckon if you're a 40-year-old bloke, you should go get a checkup. You should find a good doctor, ideally someone that is interested in preventative health, not just giving you a script for something, that wants to genuinely work with you to create better health, and get your 200,000K service, and that might be a full blood count, liver function, CRP, some lipid panels. A good doctor will know what tests to do for you, but you want to have a look under the bonnet occasionally. And the other thing I'd say to guys that it never used to be talked about much, or there's a lot of stigma about it, but mental health, if you are struggling, there's not as much stigma. There's no real stigma about it anymore. People come to me all the time, and I run a group on stress and anxiety, and people love to share. I think we're at that point now where we can lift the lid off the stigma of mental health, and just if you're struggling, just to have a chat to someone, because especially for guys, like if they are struggling, they can internalize it and they can feel that they don't want to share it. But I think we can probably say quite fairly that it's open for discussion, and there's somebody there that's going to help you.
Yeah, mate, so powerful, and definitely something that we need to focus on more, I think, is mental health. I 100% agree with you there. So if people want to work with you, Marcus, whereabouts can they find you?
I don't do a lot on the socials these days, but the osnem.com.au is the work website. If there's anyone out there that might be interested in consulting, I think my books are closed at the moment, but we open them from time to time. for new clients. So, if there's someone out there that feels like that might be the case, you can always shoot us an email at the clinic. And I am on the socials, but probably best to wait. I reckon a couple of years. I'll get that book out, Andy.
Yep. Awesome. I look forward to reading it.
Yeah.
Yeah.
Cool.
Just one last question, because you did mention about like people working with like an integrative doctor or a functional medicine practitioner. How do you go about finding someone like that? Is there an easy way in Australia to do that, or is it just luck of the draw, really?
I think always a good way to find the right professional, whether it's a doctor or a lawyer, is ask someone that's doing all right in that. Like, if you find healthy people, you might find that they're already just looking after their own health. But if ask around, ask your mates. Like, I'm looking for a really good health professional. You might, if sometimes like, you might ask the doctors who they go to as their doctor. I think that's probably a good sign. Yeah.
You're asking who his doctor is, yeah.
There's a website. ACNEM is the Australian College of Nutritional and Environmental Medicine. I think it's acnem.org. It might be .au, but there's a find a practitioner site. Most of the docs on that would have done some kind of training in nutritional medicine as a bare minimum. But that's a good question. But probably there are a couple of ideas.
Yeah, awesome, mate. It's something I often get like from a lot of clients, and we can search around their local areas, and it can be really hard to try and find a doctor for them to work with and stuff like that. So yeah, it's still a growing field, and hopefully the more it can get out there, the better. But yeah, it's just one of those things right now, isn't it?
Yeah, that's it. I think paradigms change slowly and then they change quickly, don't they? When it sort of gets to the end. So, yeah, I'm optimist. I'm an optimist. I've watched The Shawshank Redemption too many times. Not hope in the world. Just got to keep digging a little bit of that tunnel every day and walk out into the yard and just throw that dirt on the ground, and then one day you get your boat and you take people fishing out at, where was it, Tiwanaku, somewhere like that, on the Mexican coast.
Yeah, living the dream. Living the dream. That's it. All right, Marcus. Thank you very much for your time, mate. Greatly appreciated.
Yeah, and good luck with your program. When do you kick off with your program?
Yeah, hoping to launch in April, mate. So, fingers crossed it's all sort of going well, and it'll be sort of like a bit of a beta launch, but hopefully just grow over time. The initial sort of idea is just to get people moving, start exercise, but then it's going to go into a lot more detail, a lot more about nutrition, a lot more about gut health, a lot more about mindset. I'd like to get meaningful stuff in there too, the purpose stuff. But yeah, just gradually working to build a community, a tribe of men in their midlife who just want to start to work on their physique, have more energy, libido, manage or avoid chronic disease, and just look after that vitality, mate, is the goal.
Unreal. Well, best wishes with that, and I love the name. I love the Mavericks, Midlife Mavericks. It's inspiring.
That's the idea, mate.
Thanks for tuning in to the Midlife Mavericks podcast. Remember, your journey to optimal health and vitality doesn't end here. You're just getting started. Keep embracing the mindset of a maverick. Stay committed to your visions, values, and goals. Continue taking meaningful steps towards a life filled with energy, purpose, and fulfillment. Until next time, keep thriving and living life on your own terms.